My name is Lorelai and I'm going to be demonstrating venipuncture with a butterfly or the winged infusion device. So the first thing you're going to want to do is gather your equipment. I'm going to need gloves, a butterfly needle, the needle hub, a tourniquet, which I'm going to place behind my patient now. Okay. Alcohol pads, tape, the vacuum containers, and then the gauze. I'm gonna go ahead and wash my hands. And then I'll introduce myself to the patient as well as gaining consent. So my name is Lorelai, I'm the medical assistant that's working today. I'm gonna be doing your blood draw. Is it okay if I go ahead and get started? All right, can I have you verify your last name and date of birth, please? Wonderful. So, after I've gained consent and verified, I'm going to go ahead and apply my tourniquet. You want to apply your tourniquet 3 to 4 inches above the site. And I'll ask my patient to make a fist. Alright, I'm going to go ahead and palpate my vein. And when palpating, I'm looking at the median cubital or the cephalic vein. Alright, now that I've found it, I'm going to go ahead and remove the tourniquet to remain safe. And I'm going to go ahead and wash my hands again. And put on some gloves. Okay. Now that I've got my gloves on, I'm going to go ahead and connect the needle to the hub. Alright, that is all good. Then I'm going to go ahead and prepare my tape. And then I'm just going to stick right on the back of my glove. Alright, now I'm going to go ahead and clean the area. I'm going to start here and work my way out in a circular motion. Now that's drying, I'm going to apply my tourniquet. Again, you want it to be tight enough to make the vein prominent, but you also want the vein to be able to retain blood flow, so you don't want to get it too tight. Alright, once that's dry, I'm going to go ahead and take the safety off of the needle. And holding onto the wings, I'm going to stretch my vein out and go into the vein at a 30-degree angle. Continuing to hold on to my needle, I'm going to go ahead and insert the first tube. The label facing downward so I can see. Once that first tube is full, I'm going to go ahead and take it off and invert it. I'm going to put on the second tube. While that tube fills, I'm going to go ahead and remove the tourniquet. Still holding that needle in the same position. Now once that tube is full, I'm going to go ahead and remove and invert. I'm going to grab a piece of gauze and place that directly above the needle, and in one swift motion I'm going to remove the needle at the same angle I inserted and apply pressure. I'm going to go ahead and put that needle directly into my sharp spin. I'm going to take the tape off of my hand and place it on the gauze. Now I'm going to go ahead and label my tubes. After they've been labeled, I'm going to remove my gloves and wash my hands. As long as my patient is feeling all right, I'll go ahead and escort them out and then document this in their medical record.